Hi, everyone. Welcome back. Today, we're joined by Dr. Brandon Webb, an infectious disease physician here at Intermountain Healthcare, to give our community update on COVID-19 and what's been going on in the state. Brandon, thank you so much for joining us. It's nice to see you again.
You too. Thanks, Amanda.
So I want to talk about case trends first and kind of what's been going on in the state of Utah. And kind of discuss everything that's been going on. We've seen a pretty big increase of cases in the last couple of days. So I just want to walk through the numbers really quick. So our total case counts for Utah right now are 67,119. Yesterday's daily case count was 1,198 with around a 14% positive rate for that 7-day rolling average. We have a total of 444 deaths and 3,619 hospitalizations. Brandon, let's break those down a little bit. What does that mean for a hospital system, and how do you think we're doing right now?
Yeah, well, we're clearly in a second surge that right now is looking exactly like the big surge that we had in July, which is concerning because in July, the healthcare systems around the state filled up quickly. And our hospitalization rate here at Intermountain in the last week has now approached the same number of new admissions with COVID as we were seeing in mid-July. The difference is, and the trend that's concerning right now, is that in July, after the Salt Lake County mask mandate went into effect at the end of June, about mid-July, we saw a drop-off in our community transmission. And that really helped to take the pressure off of that surge in the healthcare system. And we really are looking to the community to do the same thing this time because right now our community transmission rates are continuing to increase.
And we know that school started back up and there was some sort of expectation that we could potentially see this spike, but there's been a really large spike. Yesterday was the largest case count we've had so far. And it seems a little bit concerning to me. I know that last week when I talked to Dr. Senyam, he mentioned the biggest age range that's being affected is that 15 to 25-year-old age range. This group isn't typically ending up in the hospitals, but why is it so important for them to still be careful when it comes to COVID-19?
That's a super good question. So the trend right now is really dramatic in terms of which group of people are getting the majority of these cases, what's driving this high community transmission. And like you mentioned, it really is. It's the 15 to 24-year-old age group where we're seeing the vast majority of these cases. And fortunately, the disease is less severe in that group. I will say, however, that we are seeing severe cases in patients who are in that age group who have medical conditions or are overweight or obese. And that's not trivial. We have seen some really severe cases in that age group. What is more concerning, though, is that although the majority of people who get COVID-19 in the 15 to 24-year-old age group have a fairly mild disease course, they interact with others in the community who are at higher risk. And in the last week, we've seen now a bump in our cases in the 25 to 44-year-old range, and most concerning in the 45 to 64-year-old range. So in other words, what we're seeing is spillover as these 15 to 24-year-olds interact with their parents and their grandparents and their others in the community. They are contributing to transmission in the groups that are at higher risk. And that's going to drive hospital admissions. And we're already seeing that. Our hospital admission rates are up 30% in the last week.
Wow, I think that's a number that's really important because we know that the hospitalizations and even death rates lag a lot behind the actual case counts. So yesterday's case counts of over 1,100, we won't really see that hospital effect for a couple of weeks, but the fact that our hospital rates are already up that much is hopefully a little alarming for people, and they can start to see that this is something that hasn't gone away and we still need to be taking seriously.
Yeah.
And you mentioned that now the highest hospitalization rates are kind of moving up that age range. Is it because they're interacting with people so much? And do you think it's because maybe people are going to school when they're sick, or what do you think the cause is of that?
I think that, virtually everyone in that 15 to 24-year-old age group interacts with someone in the older ages, whether it's parents or others in the community. Even at school and at college, they have interactions with adults that are in the older age groups. And so I would say our message really to those that are in the 15 to 24-year-old age group is that we're happy that the disease is not as severe for that demographic, but we really, really need the 15 to 24-year-olds to pull together and engage and help out with this community endeavor, because it is spilling over and causing severe disease, hospitalization, and we will see death in the older groups as a result of transmission from the younger groups.
I want to go over symptoms a little more too, and what someone should be looking out for when they're trying to decide if they need to stay home from school or work. Have we learned anything more about the symptoms of COVID? And if not, what are those symptoms, just so we can remind people?
Yeah. So COVID, I'll call it a chameleon again. It's a disease that's able to cause a wide variety of symptoms, and the symptoms tend to differ depending on the makeup of one's immune system, how old they are, how much of the virus they were exposed to. And we're learning now that people who wear masks consistently and yet are still exposed are exposed to lower numbers of the virus and may actually have asymptomatic disease and develop immunity. So interestingly, that's another benefit to wearing masks that we didn't recognize early on. It certainly appears that masks can prevent more severe disease, which is tremendous. So let's just talk about those 15 to 24-year-old or even younger. COVID-19 can cause very mild symptoms in those younger age groups. In the very young, so the pediatric population, elementary school or middle school age population, those symptoms can be as mild as runny nose, some fatigue, maybe a one-off fever, and be limited to that. In the older age groups, the most common symptoms that we're seeing are, again, fatigue, sore throat, mild cough. In the older age groups, we're tending to see more of the muscle aches, again, sore throat, but cough that lasts, and then in the higher risk groups, cough that develops into shortness of breath. The symptoms that are the most associated with COVID-19 are loss of taste or smell. That seems to be highly associated. Having fever and body aches and cough, that trio of symptoms is also very likely to be COVID right now, especially with low influenza rates in the community. So I think that that's the message right now, is that we've learned a lot about the symptoms. In general, symptoms are more mild in the younger populations. A runny nose and some mild symptoms does not mean that a child does not have COVID. There are a lot of other viruses circulating, but COVID can cause very mild disease. And for people who are in the adult age ranges, COVID can cause a syndrome where there's 3 or 4 days of fever, fatigue, muscle aches, and then the cough starts to set in. And where we really want to pay close attention is when patients get in that day 5, 6, 7, 8 range. If the cough is getting worse, if the shortness of breath is getting worse, that's oftentimes a sign that COVID is developing into a pneumonia. And that's the more severe or more concerning manifestation. So that's the time course that we'd want people to be really paying attention to their symptoms in.
And you mentioned this loss of smell and taste. I've kind of been following some people who have had COVID who are celebrities who've talked about it out loud. And a lot of them got it in March and April and still don't have their sense of taste or smell back. This age range, this group of people, like we've talked about, they probably aren't going to pass away from the disease, but there could be long-term effects. Have we been able to really do a lot of research about those long-term effects yet, and what we could potentially see happening to people in 10, 15 years from now if they had COVID?
Yeah, that far down the line, we really don't know. We're right now about 9 months into this, and so we're starting to understand what happens to people who've had the disease, 9 months ago. One thing that we can say is the loss of taste or smell can definitely persist. For most people, it lasts about a month. But in some cases, it certainly has been associated with longer term loss, up to 3 months or more. And people who get more severe disease can have significant decreases in their stamina, their ability to do the normal activities of life. And there's a syndrome now that's been termed long haulers disease, where people who are not as healthy and get COVID-19, even if they survive, or even if they don't have to be on the ventilator, can have long lasting symptoms that really impact their life. So, hospitalization is important, and certainly we want to save lives, but we also want to emphasize that this disease in many people can have longer lasting consequences.
And that's something that I think the general public really needs to look at. Yes, you might not pass away from the disease, but you don't know how your body is going to react to it, even if you are healthy. We don't really know enough. Like you said, it's only been 9 months, although it feels like it's been 10 years since this has started. I want to talk a little bit about the word quarantine. We've gotten a lot of questions about quarantine and what that means, especially as a parent for a child, and when you're supposed to be quarantining them, if you're waiting for a test result, and how that all works. Will you kind of break down what we want people to do in terms of quarantining?
Absolutely. Yeah. So the first thing is isolation and quarantine are the same action, but two different words because they are used in two different groups of people. Okay, so let's talk about isolation first. Isolation is what we recommend when someone develops symptoms and is going to be tested, and then once they test positive. Okay, what isolation means is, let's say you're a parent and your child comes home from school with some symptoms. Isolation means that the best thing you can do in a household to prevent transmission is actually to put that family member in their own room with their own bathroom, have them wear a mask, have them observe, careful hand hygiene, and then kind of drop meals off at the door and avoid contact while they have symptoms, while they are going to be tested, while you're waiting for the test results. Because by doing that, even if it turns out not to be COVID, whatever they do have is less likely to be spread around the household. If it does turn out to be COVID, it significantly decreases the risk of passing that within the same household. And then importantly, it actually impacts quarantine. So let's talk about the Q word. Quarantine is what individuals who've been around someone or exposed to someone with COVID do to protect themselves from spreading it before they realize they know it. So quarantine is a public health measure. It's really a community engagement thing that people do that helps to prevent them, after they've been exposed to someone, from inadvertently passing it to other people before they develop symptoms. And remember, COVID-19 is often contagious up to 48 hours before symptoms start. And so that's really that period where we get stuck, because people feel fine. And if, for example, you've had a close contact, close means within 6 feet for more than 15 minutes, or you've been around someone with COVID-19 who's been coughing or sneezing, that's a close contact. If you've had a close contact, you should quarantine, meaning you should avoid contact with others for 14 days. And the 14 days is because the incubation period for COVID-19 is up to 13 days. And we give an extra 1 day to be sure. And by doing that, you stay away from others during the full period of time where you might be developing symptom, or you might be developing the virus. You might be contagious. You might not know. And if you're not quarantining or staying away from others, you may inadvertently be spreading it around. So a lot of people have pointed out that it doesn't seem fair that if you get COVID, you are isolated for 10 days. But if you're exposed to COVID, you're quarantined for 14. And it isn't fair, but it is scientifically based, because people who get mild COVID are no longer contagious after day 10. But people who are exposed could inadvertently be spreading it for up to 14 days. And that's why.
Question about that too. So say I'm quarantining for those 14 days, I get my test results back on day 5, they come back positive. Do I now enter that isolation period of 10 days?
So the 10 days starts when your symptoms start, not when your test results back.
Okay, that's good to know. And I think that hopefully clears up. That also shows the importance of wearing a mask, especially because of that 48-hour period. Salt Lake County has a mask mandate. Utah County just instated one late Tuesday night. Previously, it was just Provo City. Now it's the entire county. When can we expect to potentially see a decline in cases if people actually follow the mandate and are wearing a mask all the time?
Yeah. In Utah, we're lucky. We've actually got really great data that shows that whenever you make a successful public health intervention, you usually don't expect to see any changes for about 2 weeks. And again, it's because you change something, you decrease transmission, but because of the incubation period, you don't start to see the effects of that for a couple of weeks. If you look at the time when the Salt Lake County mask mandate was put into effect, at the very end of June, our cases hit a previous all-time high before yesterday, about July 13th or 12th. And then in Salt Lake County started to come down. And they came down in a pretty dramatic fashion that is very clearly related to the public really engaging in that mask mandate. So the data here in Utah, right in Salt Lake County, really does suggest that by masking up starting in July, we made a big impact in community transmission. We were able to keep the economy more open, and it was better for the community just by doing that simple thing. So we're really hopeful that in Utah County, people will engage and that we'll see the same type of effect in a couple of weeks.
Yeah, and especially with schools back in session, I know that a lot of the spike has been attributed to the 2 universities down there, and you're in classrooms a lot if you're not doing online learning. So hopefully we do start to see that case count load go down there. I want to talk about a new collection method we're using for testing too. We just introduced saliva collection method yesterday at all of our outpatient sites. And for everyone watching, that basically means that you can use this collection method if you're coming to like a drive-through, but if you end up in our ER, we will still use the nasal swab. I want to talk a little bit about what the saliva collection method is and why we made the switch to this collection method.
Yeah. Well, the main reason we made the switch is because we know that nasal swab is not comfortable. But we didn't know until recently whether collecting saliva would yield the same quality of results. And we know that none of these tests are perfect, and we have roughly a 5% false negative rate. I think everyone by now has, knows someone who had a test that turned out negative and then turned out positive later. That is just a byproduct of trying to catch the virus in the act and sampling different parts of the body to try to catch the virus. But the thing to understand about the saliva method is that The only thing that's different there is that it's a more humane, gentler way of collecting the virus. And the Intermountain laboratory folks were able to validate that it is just as accurate. So it has a very similar accuracy as having the nasal swab. Maybe a couple percent different, but it's accurate enough that using it for community members is excellent. Please remember, though, that the rest of the process is still the same. So the saliva collection is not a rapid process. It still requires the lab to extract the genetic material out of the saliva, look for the virus particles, and then identify them. And so even with the saliva collection, people should still expect at least 2 to 3 days before test results.
I think it's important too for this to know there are tests that take a swab in your mouth. That is not this. Our saliva collection is a tube that you spit into, and we're asking people not to drink water, not to eat, not to smoke, chew gum, anything in your mouth for 30 minutes before you go get your test. And if you get there and you can't produce enough saliva, we still do have those nasal swabs available. And then just so everyone knows, this is only available in patients older than 6. So if you have someone younger than that, they'll still do the nasal swab. Or like I said, if you are in our ER, or if you're a mom in labor who shows up in labor, you'd still get that nasal swab. So just some differences in how we're testing. Hopefully it does make people's lives a little bit more comfortable though.
Yeah.
The last thing I want to talk to you about is just a quick update on vaccines and clinical trials. I know you've been very involved with Intermountain's clinical trials. Is there anything that we've been learning from what we've been doing, and do we have any sort of update on a vaccine for COVID-19?
Yeah, glad that we get to talk about this because I think it's really exciting. The research that's going on right now, even here in Utah, is really helping to lead the way in identifying which treatments work the best. And we've come a really long way since we started in February or March. We now understand a lot more about how to treat patients once they develop really severe COVID in the hospital. And patients who are admitted to the hospital are now treated with what has become sort of our standard approach, where we target the virus with medications and target the immune system, the excessive immune response that some people have. We target that as well. And in addition to that, patients who are admitted to the hospital have opportunities to participate in clinical trials to receive the latest in treatments that include products called monoclonal antibodies that actually bind to the virus and neutralize the virus before the virus can cause more damage. We're excited about that. We think that those are very promising. We're also excited that now, for the first time, we're starting to have some clinical trials that are available for people who are diagnosed but don't need to be in the hospital yet. And those trials are really targeted at high-risk people who are at higher risk of needing to be hospitalized, with the hope that we can actually prevent hospitalization. So starting next week and for the next couple weeks after that, there are going to be opportunities for people who are diagnosed in the community to receive or to participate in a trial studying remdesivir outpatient, to participate in a trial looking at different types of blood thinner to prevent that. And then there are also trial opportunities at the University of Utah as well, studying convalescent plasma in patients who are not hospitalized. So all of that's really exciting, and we are we're really pleased to see that our knowledge about how to treat this disease is improving. The question about the vaccine is, I think, on everyone's mind because that's critical. There are three leading candidates that are in the late phases of vaccine trials. And we're really pleased that the FDA and the manufacturers of these vaccines are doing due diligence. They're going through the right steps to test and make sure that they're safe, and going through the right regulatory steps because we don't want to cut corners. But that said, they are expediting all of these phases, and we are hopeful that by end of November, early December, we may see some results that will be promising enough to allow widespread distribution of one of these vaccines. But it's a little too early right now yet to say which of the three will be most likely to be distributed. But we are looking forward to, as early as end of the year, beginning of January, vaccines being available first to those highest risk populations and then to the rest of the community.
That's what I was just going to mention too, is the way those are going to be distributed will be really interesting. I know I'm probably going to be one of the last people on the list to get it. So it'll be interesting to see what happens. I know that there's a lot of companies, like you said, trying to get their trials through quickly. That way we can see what happens with that. But Brandon, is there anything else you wanted to mention to us today about what's been happening since last week or over the last couple of weeks in Utah?
I think we've covered a lot of ground. I think the message remains that this remains a community effort, and we really do need people to pull together and do those, what turn out to be really simple things to help decrease our transmission rates, help us maintain access to the things that are important, like education and economic considerations. All of those hinge on whether we can pull together as a community. And really that remains the message. Let's do it together.
Well, Brandon, thank you so much for joining us. We really appreciate your time. And if you guys have questions about COVID-19, you can call our COVID-19 hotline at 844-442-5224. We are experiencing high volumes of calls right now, so there could be a wait time. So please be patient and keep that in mind when you give us a call. We also have our emotional health relief hotline still available 7 days a week from 10 a.m. to 10 p.m. That phone number is 833-442-2211. Thanks, everyone. We'll see you next time.
Thanks, Amanda.
Thanks.